Hello, guys. Welcome once again to another session with Precious. That is another health session with me, Precious Chukwuagazie. And today I'll be taking you on a very interesting topic: how to lower the risk of diabetes. What is diabetes? Its types, symptoms, complications, and their causes. Please just sit tight and enjoy this wonderful tips and facts about diabetes. Now, before we go forward, what is diabetes? Diabetes is that condition that actually arises when the body does not process blood glucose or sugar. Last, the glucose or the sugar that the body gets from our food, the body cannot process it or access it, which leads to a buildup of glucose in the blood. This is a condition known as diabetes. What are the types of diabetes? We have various types. We have type 1 diabetes or juvenile diabetes. We have type 2 diabetes. We have gestational diabetes. There are various other non-common, the uncommon ones, but these are the three most common types of diabetes. The first type of diabetes, that is type 1 diabetes or juvenile diabetes. This occurs when the body does not produce insulin. That's, it does not produce that hormone. Insulin is that hormone that actually breaks down the sugar in the blood. Just imagine, once the insulin is not present in your body to break down sugar or glucose, that means your body cannot supply you energy to work, to perform your various activities, and this can actually lead to this condition we call type 1 diabetes. Whoa, so the body actually needs insulin to break down blood glucose. It allows the glucose in the food to be accessed by the cells of the body to supply energy to us. Now, people living with juvenile diabetes have to actually administer insulin regularly in order to manage this condition. Various causes could lead to this. Family history of diabetes can actually cause type 1 diabetes. Disease of the pancreas. Now, the pancreas is the organ of the body that produces insulin that we use to break down sugar. Once the pancreas is diseased, it cannot produce this insulin. It cannot perform the function anymore. So imagine what happens. The insulin cannot be produced and the blood glucose cannot be broken down. And also, infection or illnesses can actually cause type 1 diabetes when you are infected or ill. And also, this illness or infection actually affects the pancreas, then it can lead to type 1 diabetes. Now, one thing worthy of note: type 1 diabetes has no cure. No cure at all. It only requires monitoring your blood glucose levels regularly and administering insulin. Changing your lifestyle also could also help to manage it. These are the ways to manage type 1 diabetes because it has no cure. Now, moving on, type 2 diabetes occurs when the body does not produce or use insulin effectively. Now, it's either the insulin is produced in little quantity and this quantity cannot be used effectively, or it doesn't produce it at all. This condition is known as type 2 diabetes. Yes, type 2 diabetes, this is what it results to. And it is the most common type of diabetes. It has strong ties with obesity. Obesity, right? That word. Seems I'm going to talk about obesity in our next session. Now, moving on. So, medications, changes in exercise and diet can help manage type 2 diabetes. You have to exercise regularly, take your medications according to the doctor's prescription, and change your diet. There are certain diets you should take to manage type 2 diabetes. And another point again, worthy of note, is that anyone can develop type 2 diabetes, whether children, whether adults alike. Once you are 45 or older, or overweight, that's you have obesity or you are obese, or have a family history of diabetes also, you have to be careful and monitor your blood sugar levels to prevent it. Please, you have to. Now, gestational diabetes, it occurs during pregnancy. Yes, this one occurs during pregnancy. During pregnancy, women tend to become less sensitive to insulin. So this condition may arise especially when overweight. There is a higher risk of developing gestational diabetes. And subsequently, high blood pressure. So one has to stay active always. during pregnancy. Monitor the growth of the fetus, that's the baby in the womb. You have to actually monitor the way the baby is growing. And watching your diet, very, very important. What you eat during pregnancy. If you take in more of carbohydrates, sugar giving foods, this could actually lead to a high risk of getting gestational diabetes during the pregnancy process, because it's a process, yes. And most importantly, please monitor your blood sugar levels. We want to be able to manage this condition during pregnancy. And the condition often resolves after delivery. That's once you have delivered your baby, the condition actually disappears. But in some cases, it doesn't. So you have to manage it. So when you experience symptoms like peeing more often and being thirsty, or like you're always thirsty, you want to drink water, and you're always going to the toilet to ease yourself, to pee, this is a symptom of diabetes. Yes. And you're always feeling tired, fatigue, it is also another symptom of diabetes. Itchy skin, dry mouth, you're always looking for water to drink, or your skin is always itchy. Slow healing cuts or sores. Once you have an injury or a wound and it takes longer for it to heal, check it. And also belly ache. Once you always feel ache in your belly, this is also another sign. You have to call your doctor to avoid nerve damage or heart trouble, or even various other complications like eye problems or sight loss. Like you can actually have an eye problem once diabetes is not treated on time or managed. This could lead to heart problems, stroke, death, even other problems like I talked about in the last session. Kidney disease, yes. Diabetes could lead to kidney disease. I said that in the last session, yes. So we have to manage diabetes very well in order to lower the risk or avoid complications like this. Now coming to my main topic, or the main point of today's session, is how to lower the risk of diabetes. What are we supposed to do? How can we reduce the risk of diabetes? First of all, manage your blood pressure. Yes. Regularly check your blood pressure to know how to lower it or manage it. Avoid thinking too much. Worry less. Stress less. Yes, you have to manage your blood pressure in order to reduce the risk of diabetes. Eat a balanced diet. I always say this. Eat a balanced diet. Very important. In fact, eating well actually avoids many types of complications and diseases. People don't know this. Once you eat a balanced diet, you can actually avoid various things that will happen to you. Keep your weight within healthy range. Yes, that's to avoid obesity, overweight. Keep your weight within healthy range. Don't be too fat. Don't be too slim. There's a normal body range, body weight that you should be like within. So maybe when talking about obesity, I would throw more light on that. And also exercise regularly. Exercise regularly. Yes, we have to. Now with these tips, I hope we can probably reduce the risk of diabetes, getting it in the future. You can go a long way, yes. People can live without getting diabetes. But these days we hear of various people, a good number of people, any small time diabetic, I'm diabetic. Like, why? When there are steps we could take to reduce the risk of diabetes. And I hope with these few tips, I've been able to show more light on what diabetes is all about, the symptoms, the complications. Once you experience these symptoms, so let me draw my ear for you people. Yeah, call your doctor so you can know how to manage it and prevent other serious complications. Thank you so much for today's session, for listening, yes, and being patient. Thank you so much. And please don't forget to like, comment, and subscribe. Yes, hit that subscribe button. Don't forget to do so as not to miss various wonderful sessions like this. Subsequent ones to come. Don't miss it, and you'll be glad you didn't miss it. Thank you so much for watching, and once again, my name is Precious Chikwagozie, and I'm your uncle for Health Session with Precious.